Alright, hi everyone. My name's Dylan. I'm a veterinary neurologist, and welcome to this lecture on the somatic and autonomic nervous system. So I usually give this lecture as part of a neuropharmacology series, and so it really gives clinicians and students sort of a basis or a background on the principles of neuropharmacology. So it's not really focusing on the drugs in this part of the lecture, but giving you more of a background on the somatic and autonomic nervous system. If you enjoyed the video, please remember to like and subscribe at the end. Now, in terms of learning objectives, we want to cover the anatomy and the physiology of the autonomic system. The second objective would be trying to recognize and differentiate the different types of receptors that are found in the autonomic nervous system. We'll then talk about the physiologic effects on the body when the autonomic nervous system or these receptors are actually stimulated or blocked. In the next half of the lecture, and I'll probably post a second video on this, we'll talk about some common veterinary conditions as well as the drugs used to treat these conditions. And they will, again, have a very heavy focus on the autonomic nervous system. Alright, so we'll start the presentation by first talking about classifications of the nervous system. We then focus on the anatomy of motor nerves, followed by physiology of the autonomic nervous system. In that part of the lecture, we'll talk about neurotransmitters as well as receptors. And then finally, we talk about something called the effector cells and organs. And again, like I said previously, the second half of the lecture will actually focus on conditions as well as medications. Now, when we classify the nervous system or focus on the classification of the nervous system, it's really important to have a good understanding of how it's broken down. And obviously, the nervous system is a very complex region of the body, and so it can be very tricky to sort of categorize it. But the easiest way to remember it is you have your central nervous system as well as your peripheral nervous system. The central nervous system can be broken up into your brain and your spinal cord, while the peripheral nervous system, we tend to think about the motor nerves and the sensory neurons. The motor neurons are further divided into your somatic nervous system, and we'll talk about that in the next slide, and the autonomic nervous system, which are further divided into your parasympathetic and sympathetic nervous system. So this is pretty self-explanatory. When we talk about the central nervous system, it's really whatever's in the center of a patient or runs centrally. And the way to think about it is that anything that happens to be right in the middle of a dog, so anything from your brain, spinal cord, they form the central nervous system. Now, the peripheral nerves or the peripheral nervous system have a few components. We talk about things like your motor nerves. So motor nerves are nerves that basically branch out of your nervous system to have or provide a patient with motor function. And so motor function is, for example, the ability to move your limbs, move your arms. It can be even moving your facial muscles. And sensory nerves do the opposite, right? So they provide, or at least provide your body, or take in feedback from the environment and provide that to your brain. So it's sensory nerves taking sensations in. For example, when you get touched on your hand, you take that feedback or that sensation, and that goes up your sensory nerves. It feeds into your spinal cord and goes towards your brain. The motor nerves usually transmit signals across what we call neuromuscular junctions, and then it feeds that information into target organs. In some cases, that could be your muscles. In some cases, it could be like your cardiac muscles as well, or even smooth muscles in your body. So motor nerves have a neuromuscular junction at which neurotransmitters are fed across, which we'll talk about shortly, and then you have your target organ, which has some forms of muscles. And if we look at the little diagram here, this is an example, a very sort of a broad schematic of how most motor neurons look like. So the motor neuron is this region here. You have your cell body. Cell body is really the working region of the cell. And from here, a signal is, or action potential is actually transmitted across. You have what we call your axon terminals. And from your axon terminals, it has a neuromuscular junction in which neurotransmitters are fed across towards your muscle or target organ. In this case, the target organ is a muscle fiber. When we look at the motor neurons, as we said previously, we have two further ways to categorize them. We either have your somatic nervous system or your autonomic nervous system. And again, that can be further divided to your parasympathetic and sympathetic division. The somatic nervous system is basically voluntary. The word somatic or soma means body, and your target organs is usually your skeletal muscles. So the diagram or the image on the right, you can see some examples of your motor nerves. For example, your femoral nerve here. So your femoral nerve is a really good example that starts from your spinal cord region. It then branches out to innervate different muscle groups. For example, your quadriceps muscle, which is responsible for extension of your limb, or in a canine or in a dog, it actually helps with extension of the pelvic limb. So the femoral nerve again helps the patient extend it. And this is under voluntary control. So voluntary control means it's mediated by your forebrain. You have very conscious ability to process that movement, and you're very aware of what's happening. And a very easy way to think about it is if you choose to throw a ball for a dog, you are activating your hand muscles, and that act of throwing a ball is you consciously activating or using your somatic nervous system to activate your arm muscles to actually throw the ball. The autonomic nervous system is a little bit different in the sense that it's involuntary. Your target organs are not skeletal muscles, but your smooth muscles. Smooth muscles are found in, for example, your gastrointestinal tract, cardiac muscles, and glandular organs like your lacrimal glands, your salivary glands as well. Now, when they say autonomic means it happens by itself, so it's not under voluntary control. And if we take that same example of you throwing the ball for the dog, your heart rate actually increases when you exercise. So by that sort of passive process, your heart rate goes up to increase perfusion through your body. And when we say autonomic, that's not voluntary control. So your heart rate actually goes up by control of your autonomic nervous system. If we look at the diagram here, on the right, you can see a very nice drawing of how the autonomic nervous system is broken up. The diagram can seem a little bit intimidating or confusing at first, but I'll explain and break it down a little bit more. So over here, we have this region which is called your brainstem. So your brainstem is further divided into your midbrain, your pons, and your medulla. Don't worry too much about that right now. But this is a top-down view of the spinal cord here, and you can see the different segments. And then this is where the spinal cord ends, right over here. From the spinal cord, you will notice that you have nerves that actually branch out from there, and that's what we call your autonomic nerves. So the autonomic nerves branch out to actually control different organs in your body. For example, your eye has some level of sympathetic control, so do your glands, your lungs, your heart, your gastrointestinal tract, your bladder, and your reproductive organs as well. The sympathetic nervous system and the parasympathetic nervous system both have control over several organs, so they have sort of a shared control over several organs in the body. But as we start to talk about these organs, you will find that the sympathetic and the parasympathetic nervous system both have very different roles over these organs. For example, your sympathetic helps your heart increase its heart rate, whereas your parasympathetic, which is under control, for example, your vagus nerve, actually drives your heart rate to go down. So it's all a balance between your sympathetic and your parasympathetic nervous system. Now, in a general sense, your parasympathetic division has a big role of what we call rest and digest. So rest and digest is a mode in the body that helps you conserve energy, you're storing energy, you're in a relaxed state. Sympathetic division, again, is one of the primitive divisions or evolutionary mechanisms in the body that helps you survive. So it's what we call your fight or flight system. It helps burn through energy and actually breaks down energy. So a very simple way to think of the different branches of the autonomic nervous system is your parasympathetic helps you relax, rest, and digest, and your sympathetic division actually is more for a fight or flight, where it's in a survival mode. Now, when we talk about the different organs that they control, I already went through this, but basically the sympathetic and parasympathetic system often control the same organs, but they produce different effects. All right, so let's just focus on the anatomy of the motor nerves and just go through a little bit more detail on how they look like, what's happening at that level. So let's talk about the organization of the nerves. In the somatic motor system, you would note that you have your nucleus, which is represented by a circle here. It's a single motor fiber or single peripheral motor fiber that is connected directly to your skeletal muscle. Now, the example or the ones that we looked at, for example, your femoral nerve, you have your nucleus that sits in your spinal cord region. It then branches out to synapse onto your muscle group, which is a skeletal muscle in that case. The sympathetic, or the autonomic nervous system rather, is a little bit more complicated in the sense that there are two contributing fibers before it reaches your target organ. Usually we call the first part of the nerve the preganglionic fiber, and we have what we call the postganglionic fiber. So you note that in both your sympathetic division and your parasympathetic division, there are both preganglionic and postganglionic fibers. So it's a two-fiber system. The preganglionic fiber has its nucleus, again, in the central nervous system. So it could be at the level of the brainstem or in the spinal cord. And it has what we call a ganglion. So a ganglion is defined as a cluster of cell bodies or nerves that's outside of the central nervous system. It could be in your sympathetic trunk, and it could be somewhere in the abdominal cavity in some cases, but a ganglion, basically, it's a cluster of cell bodies or nerves that sit outside the central nervous system. So the preganglionic fiber synapses on the postganglionic fiber at the level of the ganglion. It then causes its way through the body before reaching the target organ. And just to sort of re-emphasize, the target organ in the case of the autonomic nervous system is usually either your glands, your cardiac muscle, or your smooth muscle. Now, how does that apply to this image that we looked at over here? So if we look at the sympathetic nervous system, you'll see that most, if not usually all of the sympathetic nerves or preganglionic fibers start from at the level of the thoracolumbar spinal cord. It then comes out, synapses at this level here, and that's your ganglion, which we call the sympathetic trunk. So it's just a specific feature of a chain of ganglions here. The postganglionic fiber then comes out and it branches and reaches your target organ, which is the lung in this situation here, or this case here. Now, if we take, for example, your parasympathetic nervous system, let's use the oculomotor nerve, for example. So the first one here, it starts from your brainstem. And from your brainstem, the preganglionic fiber comes out, synapses onto a ganglia, in which case this is the ciliary ganglia, and the postganglionic fiber comes out to reach your target organ, which is your eye. And so you can see that for all the different target organs, you have the preganglionic fiber coming out from the central region before having a ganglion here, and finally reaching a target organ. So the three functional divisions are your preganglionic fiber, postganglionic fiber and your target organ, and that's the organization of an autonomic nerve, and it's the fundamental and the basis, sort of the really basic structure for most of the autonomic nerves. Now, several features of the autonomic nerves are worth remembering. So, like we said in the previous slide, the preganglionic fiber starts in the central region. So, for the parasympathetic nucleus or the preganglionic fiber, the nucleus of the preganglionic fiber starts at either the brainstem or the sacral region of your spinal cord. So, just top and bottom, really. And that's the way to remember it. Whereas the sympathetic nucleus for the preganglionic fiber starts at the level of your thoracolumbar spine. So you can see that that's right in the middle here. Now, in terms of your postganglionic fiber, we have a specific feature called your sympathetic trunk that's running all the way down here. And finally, we have what we call the target organ. And so your target organ could range from your eyes, it could be your glands, your lungs, your heart, your GI tract, bladder, and your reproductive organs. So here's a list of basically all the target organs, the sympathetic division and the parasympathetic division on either side here. You will note that some of the target organs are only under control by one division. For example, your skin and the merocrine sweat glands in your erector pili muscle have only sympathetic control, whereas things like your iris sphincter is only under control of your parasympathetic division. So I guess the unique feature of some of these target organs is that it's only controlled by one of the divisions of the autonomic nervous system. Down the middle, we have the different receptor types that are expressed by the target organ, and for the next half of the lecture, we'll actually focus on that. So once you understand the anatomy and get a good grasp on the preganglionic, postganglionic fibers and the target organs, we can talk a little bit more about the physiology and what happens at that level. All right. So let's focus a little bit on neurotransmitters before we talk about the receptors, and this is covered in the basic physiology of the autonomic nervous system. Let's start by defining what neurotransmitters are. So a neurotransmitter can be defined as a chemical messenger that facilitates communication between your neurons and other cells in your body. Let's focus on the two major neurotransmitters of the autonomic nervous system. So the first one is acetylcholine, and the second one is noradrenaline. And it depends on which part of the world you practice in, but in the States, they will call it norepinephrine. Basically, in terms of terminology, we always use the words cholinergic to represent something to do with acetylcholine, and the words adrenergic to do with noradrenaline. So you hear terms like adrenergic drugs, cholinergic drugs being used all the time. Now, how do they apply, or where are these neurotransmitters found? If we look at that very similar image here, the one that we talked about in the anatomy section, you'll see that at the level of the sympathetic division, just to give you a quick recap, the preganglionic fiber synapses at the level of the ganglion onto the postganglionic fiber, followed by the postganglionic fiber synapsing on the target organ. Now, at the level of the sympathetic division, the pre and the postganglionic fiber have the neurotransmitter of acetylcholine. So they communicate with a neurotransmitter called acetylcholine. It's very similar in the case of the parasympathetic division. It uses acetylcholine as the neurotransmitter between your pre and postganglionic fiber. Now, this is where things are a bit more interesting. At the level of your sympathetic nervous system, or your sympathetic division, your postganglionic fiber uses a different neurotransmitter. It uses norepinephrine or noradrenaline as your neurotransmitter talking to your target organs. The parasympathetic division is a little bit different though. It uses acetylcholine, so the same as the pre- and postganglionic fiber neurotransmitter, to communicate with your target organs. So the easiest way to remember it, sympathetic uses noradrenaline, or norepinephrine, whereas your parasympathetic uses acetylcholine. If you think about the times you were here, the words adrenaline being used, we always say, oh, I'm having a bit of a fight or flight moment. I'm having a lot of adrenaline in my blood. I'm having a rush of adrenaline. This is exactly where it comes from, the point of the post-ganglionic fiber talking to your target organs. And we'll explore that a little bit more in the next few slides. So when we talk about terminology, again, there's going to be a lot of description of terminology in this lecture. The sympathetic division sometimes may be referred to as the adrenergic division, and that just refers to the postganglionic neurotransmitter here of adrenaline. And sometimes the parasympathetic division can be also referred to as the cholinergic division, and again, that just refers to the acetylcholine neurotransmitter that talks to your target organ from your postganglionic fibers. All right, so we'll talk about receptors now. It's pretty straightforward when we think about the receptors. So cholinergic, remember, it means to do with acetylcholine. Cholinergic or acetylcholine response on the neurotransmitter of acetylcholine has cholinergic receptors, whereas noradrenaline or adrenaline responds to adrenergic receptors. The way they're named, or these adrenergic receptors are named, are not very creatively named. So you have alpha 1, alpha 2, and they all represent the different subunits or subgroups on your receptor themselves. Beta 1, 2, 3 are all examples of adrenergic receptors, and they are just, again, different ways to name the subunits on the receptors themselves. Now, in terms of cholinergic receptors, we have both nicotinic and muscarinic, so they're a bit more interesting names. And they're really the sort of chemical compounds that were tested in the lab and what they responded to. So, for example, nicotine is what's found in your cigarettes, and so you have what we call nicotinic receptors. They can be represented by a little small alphabet N, ACH, and R for the word receptor here, or a capital letter N as well. Muscarinic receptors, on the other hand, respond to muscarine, which is found in a mushroom or the Aminata mushroom, from my understanding, and they're represented by either M1, M2, or M3. To now focus on the cholinergic receptors and where are they found in your autonomic nervous system, we look at the two different types. So let's focus first on the nicotinic receptors. So nicotinic receptors are primarily found in two regions. They're either found on your skeletal muscles. So again, we had that schematic image, if you remember. You have your nucleus here, a single motor fiber, or single nerve fiber. You have your neurotransmitter of acetylcholine. Now you see this capital letter N that represents your nicotinic receptor, and by activating it with the use of acetylcholine, you have skeletal muscle contraction. They are usually found in your postsynaptic ganglia of the sympathetic and parasympathetic division as well. So if you look at these two following images, the pre and post ganglionic fibers communicate with acetylcholine, and they have nicotinic receptors found here. And again, in your parasympathetic division, your pre and post ganglionic fibers have nicotinic receptors found here. They are sodium and potassium ion channels. All right, so muscarinic receptors, on the other hand, are found primarily in your target organs of your heart, your gastrointestinal region or gastrointestinal tract, your bronchioles, urinary bladder, as well as your exocrine glands. So let's just go over that. They are G protein coupled receptors. So let's look at this image here of your parasympathetic division. You can see the preganglionic fibers talking with acetylcholine as your neurotransmitter to your nicotinic receptors here in your postganglionic fiber that talks with your neurotransmitter of acetylcholine, finally reaching your target organ, which expresses the muscarinic receptors. So in the heart, you have muscarinic receptor, or M2 specifically, The gastrointestinal tract has a combination of M2 and M3s. M3 is found in your lungs, so your bronchial region, and then the urinary bladder has, again, 2 types. Adrenergic receptors are found primarily, again, in different organs throughout your body. The alpha or alpha 1 has a very excitatory effect. So it's a G protein coupled receptor, and you can see here in your sympathetic division, it's found at the erectopili region, your blood vessels. And I think that's the main ones that we really need to remember when we learn the application of neuropharmacology. So you can see, just to go over this image again, preganglionic fiber, acetylcholine, nicotinic receptor on your postganglionic fiber, you have norepinephrine or noradrenaline here, and you have your alpha receptors found on your blood vessels. Beta receptors are another form of adrenergic receptors. They're G protein coupled receptors, and they have multiple effects. So they're found on at the level of your heart, gastrointestinal tract, bronchioles, as well as your urinary bladder. Now there are a lot, and we had a whole list of receptor types. There are a couple of ways to, or important ones to remember rather, and when we apply them to like veterinary neuropharmacology, the ones that I try to remember are really the alpha ones, beta 1, beta 2, and where they're found. So one of the very important ones to remember is the alpha 1 receptors. Now alpha 1 vasoconstricts blood vessels, and the way I've been taught to sort of remember it is alpha looks like a little bit of a loop here. And alpha 1 represents this red line, or it looks a little bit like a vessel. So if you take that loop and loop it around the vessel, it looks like vasoconstriction. So that's how I think about it. So that's vasoconstriction of blood vessels. Beta adrenergic receptors, you have beta 1. So like I always remember 1 heart, 2 lungs. And the way to remember it is, if it helps at all, like the beta sign, if you flip one of the beta sign and put them together, it looks like a pair of lungs. Beta 3 is found in the bladder, so I always remember top to bottom 1, 2, and 3, the bladder being the lowest point in the body, or one of the lowest regions, and so 1, 2, and 3, so 1 heart, 2 lungs, and then your bladder at the bottom. So the nicotinic receptors, just remember they're found in your muscles, as well as the point or the ganglion between your pre and postganglionic fibers. And for the most part, muscarinic receptors are either M2 or M3, and they're found again in your heart, gastrointestinal tract, and your bladder. All right, so let's do a major recap of what we have. Now, in terms of control, the somatic nervous system is under voluntary control. The autonomic nervous system, again, being automatic or autonomous, it's involuntary. So you don't have a conscious ability to control these different organs. In terms of your target organ, your somatic nervous system is under control of your skeletal muscles, whereas in your autonomic nervous system, you have different muscle groups like your cardiac muscles, your smooth muscles, as well as glands. When we looked at the schematic, we went over the somatic nervous system, and it's a one sort of direct motor neuron before synapsing on your muscle, whereas in your autonomic nervous system, you have your preganglionic and postganglionic fiber. Now, in terms of neurotransmitters between your pre and postganglionic fiber, it does not exist for your somatic nervous system because it's a single neuron. However, in your autonomic nervous system, they communicate with a neurotransmitter called acetylcholine. And that happens in both your sympathetic and parasympathetic division. Let's focus a little bit on the neurotransmitter from the postganglionic to the effector organ, and that's acetylcholine for somatic nervous system, and it's also acetylcholine in your parasympathetic nervous system. Now, in terms of your sympathetic nervous system, you then have noradrenaline or norepinephrine, and that's more of a different one from your conventional acetylcholine. The receptor types, we talked about nicotinic receptors being a form of cholinergic receptors, and they're found basically in your skeletal muscles. Whereas in your parasympathetic division, you express a different form of cholinergic receptors called your muscarinic cholinergic receptors. The sympathetic division has then alpha and beta as your forms of adrenergic receptors, which are expressed on their target organs. All right, finally, we'll talk about what we call the effector cells and organs. So the effector cells and organs. So this again, I keep showing this image, but it really summarizes the different target organs very nicely. So your eyes, glands, your heart, your lungs, your gastrointestinal tract, your bladder, as well as your reproductive organs. I'll focus on some specific target organs and try to put all that information that we just talked about into perspective here. So when you look at like images like that, it can seem a little bit intimidating initially and just a little bit confusing. But if we take that basic principles from before, it makes a lot of sense. So we talked about post-ganglionic fibers, receptors, and neurotransmitters. So we'll take all that information and try to place that into this image here. So let's just focus specifically on the sympathetic region and the parasympathetic region here. Now, for the sympathetic division, can you identify the preganglionic fiber? So that's right over here. And you see that the preganglionic fiber then synapses at the level of the ganglion, which is called the caudal mesenteric ganglion here, before the postganglionic fiber comes out to synapse onto different regions, which are your target organs. In the case of the bladder, the target organs from your sympathetic division are your bladder wall and your internal urethral sphincter. So this pink region here, which is a smooth muscle. Same thing with your parasympathetic region. You have your preganglionic fiber, your ganglion here, your postganglionic fiber, and obviously when you synapse over this region here, you're going to have your receptor and your neurotransmitter. We focus a little bit more now on the somatic region, and so that's like we talked about. Based on that schematic, it's a single motor fiber without a pre and post ganglionic fiber. So you have a direct motor fiber that synapses here onto your urethralis muscle. And when we apply the receptor types and the neurotransmitters, it all falls into place and will make a lot of sense. We talked about the sympathetic division having adrenergic receptors, and the neurotransmitter being noradrenaline or norepinephrine, and you can see that that's beta receptors here. And here you have alpha and beta receptors. Whereas in the case of the parasympathetic division, it's not really shown in this diagram, but the receptor type is a muscarinic receptor here. Same thing with the urethralis muscle, because it's under control of your somatic nervous system, your receptor type is really a nicotinic acetylcholine receptor type. So let's talk a little bit about the sympathetic control with the bladder. So we'll focus a little bit more on the function of the hypogastric nerve. For each of these target organs, we will focus on the origin, so where the preganglionic fiber starts and the cause of the nerve and where it directs itself. We'll talk about the target organ, and finally we talk about receptors and the effects of stimulating the receptor with the neurotransmitter. In the case of the hypogastric nerve, it starts in your lumbar segments in the dog, so L1 to L4. So from the lumbar, it causes its way to reach a region called the caudal mesenteric ganglia. From there, the hypogastric nerve takes its course and ends up at 2 points. So you have your bladder wall and your internal urethral sphincter. And we talked about this previously. The smooth organs tend to be your target organ, and so the smooth muscle here is, or the internal urethral sphincter has smooth muscles. The receptor type's a little bit different, so you have beta 3 that's found in your bladder wall, and alpha 1, which is found in your internal urethral sphincter. Now, what happens when neurotransmitters actually stimulate these receptors? Think about the effect of fight or flight. In a state of sympathetic activation, you do not want to pee, so it helps you almost store or fill your bladder up. So in the process of activating or stimulating these receptors, what will happen is you start to relax this bladder wall, and you want to contract down on the internal urethral sphincter. So by that process, the bladder starts to fill up. Now, in terms of the parasympathetic division, we have something called the pelvic nerves. The pelvic nerves start from the sacral region. They synapse onto your pelvic ganglia. Now, from your pelvic ganglia, they then synapse onto your bladder wall on the muscle called the detrusor muscle, where they secrete, or that postganglionic fiber releases neurotransmitter of acetylcholine, and your receptor type being M3, a form of muscarinic receptor that results in contracting the bladder. So think about it again, when you rest and digest, you want to release that bladder, you want to contract the bladder and actually start to urinate. So parasympathetic and sympathetic, they have control over the same organs like we talked about, but they have very different functions and very different roles. I want you to think about the origin now. So we talked about the sympathetic and the parasympathetic divisions, or the preganglionic fibers, being found at the different levels, or starting at different levels of your central nervous system. So if you can try to think about that when we talk about target organs, that would be very helpful. And just remember, the preganglionic fibers in the parasympathetic nervous system start from your brainstem or your sacral region, and the in terms of your sympathetic division, the preganglionic fibers tend to start from your thoracolumbar region. So what do I mean by this? If you look at your hypogastric nerve from the slide before, it starts from your lumbar region here, whereas in terms of your pelvic nerve, it actually starts from your sacral region. So we also have somatic control over our bladders. And when we said somatic control, we talk about it being voluntary. And voluntary control means that we have conscious control over the organ. But we also mentioned that somatic control means there's some involvement in skeletal muscles. So when we talk about the origin of or what nerves are involved, here we have what we call the pudendal nerve. The pudendal nerve starts from a region called the sacral spinal cord, so it's very similar to the pelvic nerve in the S1 to S3 region in a dog. The pudendal nerve is then this single nerve fiber that actually synapses on the uretralis muscle that controls the what we call external sphincter. The neurotransmitter in this case is acetylcholine, and the receptor is a nicotinic receptor. And if you remember, nicotinic receptors are a form of cholinergic receptors. They function to control and give contraction of the external sphincter, and that's voluntary because it's under the somatic control. Let's focus on eyes for a second. And we talked about, again, for these cases, looking at the image, it can always seem a bit intimidating or a little bit confusing. But if you look at it from a perspective of preganglionic, postganglionic fibers, receptors, and neurotransmitters, everything starts to make a lot more sense. So if we start with, say, the parasympathetic division, we start with the preganglionic fiber, and that starts from the brainstem. So if you remember that again, the parasympathetic division, the preganglionic fiber either starts at the level of your brainstem or your sacral region of your spinal cord. So the preganglionic fiber starts here and starts from a nucleus called the parasympathetic nucleus of cranial nerve 3. It then comes out from your brainstem. It synapses to your postganglionic fiber at the level of your ciliary ganglion, and the postganglionic fiber makes its way to your eye. And it really controls your iris sphincter, which helps with constriction of your eye, and basically it's a response to bright light being shone in. So if you're familiar with what we call the pupillary light reflex, that's mediated by your parasympathetic division of your eyes. Now the sympathetic division is a little bit different. It has a very long pathway, and it takes its way or starts from the region of the brain and makes its way all the way down here to your thoracic spine. From your thoracic spine, the nerves actually come out at the level of T1, T2, and T3, and it starts your preganglionic fiber at this level here, synapses onto your cranial cervical ganglion, and your postganglionic fibers cause their way through the inner ear of a patient, and it ends up at the level of your target organ, which is your eye in this case. The sympathetic role is very different, so it helps your eyes to dilate And the dilation of your eye can be in response to fear, excitement. If you see a cat who gets really excited and there's a lot of or a heightened state of awareness, you have bigger pupils, and so it's your iris dilator. So when we look at the sympathetic control over the eyes, its role is to dilate, and the usual dilation is a response to fear. It could be excitement, but increased sympathetic tone results in dilation of your eye. Now, the nerves that are involved in that are a little bit more complicated, but it starts from your brain. Sometimes they call that the first order or the first order region, and so it starts at the level of your tectum, so they call it the tegmental spinal tract that actually runs down your spinal cord over here. It then branches out from your thoracic region, so around your arm at T1, T2, T3, and it causes its way up through the neck via your vagosympathetic trunk. The preganglionic fiber here then synapses onto your cranial cervical ganglion, and your postganglionic fiber finally reaches the target organ, which is in this case your iris dilator. The iris dilator has receptors which are alpha adrenergic in nature, and they are responsible for dilation of the pupil, which we call mydriasis. The neurotransmitter, since it's sympathetic, is norepinephrine. In terms of your parasympathetic control over the eye, it's your parasympathetic branch. Again, it starts from your brainstem, so that's the preganglionic fiber. It synapses at the level of something called your ciliary ganglion, and from there, the postganglionic fibers target your iris sphincter. Now, the receptor is a muscarinic receptor because it's parasympathetic, and if you remember parasympathetic, the neurotransmitter is acetylcholine. So this neurotransmitter, or the neurotransmitter involved, is acetylcholine, which results in constriction of your pupil. And the response is usually, or what stimulates this reflex is light. So the same thing applies here. You can pause the video. You can try to identify the different pathways for your preganglionic, postganglionic fiber. You can try to identify the receptors as well, and think about the neurotransmitters. So the heart and the lungs, you will see that they have very similar nerves involved in their control. If we focus on sympathetic control of the heart, it's via your sympathetic branches. They start from a region called your intermedial lateral nucleus, and they start to cause its way into your chest cavity. They synapse into your middle cervical ganglion. Now the branches then come out to target your heart receptors, in which case for the heart, if you remember we said one heart, two lungs, so that was beta 1 receptors. The beta 1 receptors respond to noradrenaline, and so if you think about it, when you give a patient adrenaline in the case of cardiac arrest, this is exactly what you're doing. You're stimulating the beta 1 adrenergic receptors. So these target organs, or the regions, or more specifically the regions that express this beta 1 adrenergic receptors, are the SA node, or the sinoatrial node, the AV node, the atrioventricular node, or your myocardium. Now, these receptors, again, just to stress the point, they respond to noradrenaline or norepinephrine. When they're stimulated, they can do a couple of things. So they either increase your heart rate, which is called chronotropy, and they increase contractility, which is called inotropy. Parasympathetic neurologic control of the heart is from a nerve of one of your cranial nerves called your vagus nerve. So that vagus nerve starts from a region in your brainstem called your medulla, or medulla oblongata, and it causes its way down to your heart and makes its way here, and the postganglionic fibers then synapse onto your SA node or your AV node, and to the receptor types, more specifically M2 receptors. And when stimulated, they decrease your heart rate, so negative chronotropy, and the receptor type is acetylcholine. So now if we think about drugs, and later on we talk about pharmacological agents that actually help with the help you increase heart rate. There are really two ways to increase heart rate. We can either stimulate the heart receptors, the beta 1, by giving things like adrenaline, and that would raise your heart rate. But at the same time, other drugs which are like atropine or glycopyrrolate, which are anti-muscarinic agents, they can antagonize your muscarinic receptors by blocking it. And so if you block these muscarinic receptors, then if you're decreasing that vagal tone or the stimulation of the vagus nerve, you are increasing heart rate in that sense. But they have very different purposes, and basically there are very different functions when we do it in terms of anesthesia use or even clinical use. Sympathetic control over the lungs, again, they are quite similar in terms of the heart or the nerves that are shared by them. You have your thoracic segments, synapses in a region called your paravertebral ganglia. From there, your ganglionic fibers synapse in your heart, and again, the receptor type is your beta 2, and so beta 2 being a form of adrenergic receptors. Think about rest and digest in this case. Fight or flight in this case. So in a fight or flight state, when your sympathetic nervous system is stimulated, you want to open your airways, so you want to have more gaseous exchange, and so you bronchodilate. The target organ being your bronchial smooth muscles. The opposite happens. So when you stimulate your parasympathetic nervous system, your vagus nerve here has control of your lungs, and so the postganglionic fibers secrete acetylcholine, and they have target organs of your bronchial smooth muscles and your mucus glands found in your lung tissue. The act of stimulating muscarinic receptors or AMPA receptors then helps with bronchial constriction or increasing mucus production, and obviously your neurotransmitter being acetylcholine. Now we focus a little bit on the skin and the vessels. So in the case of skin and vessels, it's pretty unique in the sense that we focus mainly on the sympathetic division of the nervous system. The vessels in our body are primarily controlled by your alpha 1s, so they vasoconstrict. Now in terms of their role, the preganglionic neurons are found in your thoracic spinal cord segments, and so they branch out from a wide range or a wide segment, regions of segments of your spinal cord, and they come out and synapse onto your sympathetic chain ganglia. And the postganglionic fibers, they basically course through spinal nerves towards your skin. Now the target organs could be either your cutaneous blood vessels, your sweat glands, your erected pili muscles, and they're primarily alpha 1 adrenergic receptors. And if you remember this, we said alpha 1 looks like a little loop over a vessel, and it helps to vasoconstrict. At the level of the skin, it has piloerection or erected pili, which is what we always say when you have goosebumps, your hairs stand on their edge. So that is another form of sympathetic stimulation. And for the purpose of this lecture, I just don't want to confuse anyone, but there's a very unique one, which is the M3 on the sweat glands, and it's actually the use of acetylcholine through the sympathetic division. So it's a bit of an exception here. But for the sake of, just following the convention, it's a neurotransmitter that's associated with the sympathetic division, so it's going to be noradrenaline. Now, again, with the gastrointestinal tract, it's a little bit complicated, or there are definitely a lot more gastrointestinal organs here. So if you just want to take some time to pause this video, have a look through the different branches. So I've just listed both the parasympathetic and the sympathetic branches, and if you can try and identify the preganglionic nerve and postganglionic nerves, just think about the different receptors and different neurons as well. And we can work our way to the next slides from here. So the sympathetic neurologic control over the gut starts from your thoracolumbar spinal cord segments, and the synapse, again, you have a very specific or prevertebral ganglia. The postganglionic fibers then follows its way to the gastrointestinal tract. Now the target organs are really a set of smooth muscles that are in your gastrointestinal region, as well as the blood vessels there. The receptors are really a combination of both alpha and beta adrenergic receptors, and the general goal is to decrease peristalsis and to a certain extent have vasoconstriction to the GI organs. But you are slowing down your gut in a state of sympathetic activation. So in a fight or flight mood, you really don't want your gut to be moving too quickly, and your neurotransmitter is noradrenaline. Now, in terms of your parasympathetic division, you have your vagus nerve, which controls what we call the foregut and midgut, so the top two regions of your gastrointestinal tract, and your pelvic nerves controlling your hindgut, so your colonic region and more whatever's more caudal in your body. Target organs being your smooth muscles of your GI tract and secretory glands. Obviously, this is parasympathetic, so the receptor types that we're dealing with are mainly muscarinic. They tend to help with the increasing peristalsis and vasodilation to organs. And as you know, you should know this by now, any form of parasympathetic activation has a neurotransmitter of acetylcholine. All right. So that's all done. We'll continue the rest in our second lecture and go from there.